Much for being back at Revolutionizing Healthcare. Today's quite a special session where we're going to talk about experiences of clinicians in machine learning or even in a dedicated AI lab. And the idea is that we're going to share some experience, sort of give some guidance to people who are just starting out, but probably also offer some inspiration for people who are further along in their journey. And we're really fortunate today to be joined by several guests who are part of the Revolutionizing Healthcare community, and we're really glad to have you all with us. This session is going to work almost as usual. After this introduction, we'll have a brief intro by Mihaela, followed by an introduction by Tom Callender, one of our panelists, and then each of our panelists has prepared a short introduction to their work and challenges they faced along their way of getting into machine learning. Following that, we'll have a more open panel discussion, and for that, please also feel free to submit Q&A questions at any time in the chat. You can also just upvote the most important queries just using the emoji features. So, given that our panel is bigger than usual, let me just say thank you all so much for being here. We have Dr. Tom Callender with us, Dr. Aizaan Anwar, Dr. Marco Montagna, Dr. Valerie Vandeweerd, Dr. Crina Samarghitean, and Dr. Avneesh Khare. I hope I pronounced your names at least half correct. And we're really excited to have you all. Thank you for joining us. Without further ado, I would like to hand over to Mihaela.
Yeah, so thank you very much for joining us today. I was very excited and happy that so many people volunteered to join this session and talk about their experiences. I am, if you like, the person on the other side. I'm a machine learner that is very keen to collaborate with clinicians, and I had the good fortune to have not only numerous clinical collaborators, but also to have quite a few clinicians, either clinicians in training or clinicians being in the lab, visiting our lab, working very closely with us. So I want to tell you what is the excitement from my side, from a machine learner's point of view, when you come and visit us. First, we love that you are helping us co-create meaningful problem definitions. So you bring a real-world grounding we desperately need in machine learning. If you walk in a machine learning lab with a puzzle that matters to patients and to healthcare, you are offering us something extremely valuable and much more valuable than data sets. You are offering us a problem and a direction to follow. And this helps us because we can focus on clinically relevant, solvable problems rather than solving toy challenges, which we often do in machine learning. Another thing is about your help to interpret data and define ground truth. We know what the AHRs don't say, and your judgment helps us define labels, helps us define confounders, and understand where data may be incorrect. Also, you can help us stress test the models we are building in realistic scenarios, in realistic workflows. And in this way, you can help us ensure that what we build has indeed impact, not just a very high performance. Define what success really looks like. You can tell us when a model is clinically actionable. And what does this mean? Because error on the receiver operating curve doesn't mean much if the answer doesn't change what you as clinicians will do. So you can help us tremendously in defining true success. You also can help us offering a longitudinal insight. You live the story of a patient over the years, and you can help us understand that and teach machine learning some of your know-how. This enables machine learning labs such as mine to model patient trajectories, to understand decision-making over time, what matters, what doesn't, what do delayed outcomes matter. And also, maybe finally, I really feel that if you join a machine learning lab for a short visit or a longer visit, you enable us to spark curiosity as well as mutual learning. So don't just visit us to give feedback, visit us to learn, to challenge us, but also to dream with us. And I hope that you could go back seeing your clinical practice differently and build everlasting partnerships that inspire both fields towards innovation. And I've been extremely fortunate to have the two teams that are chairing this session visiting my lab a few years back, as well as have Tom Callender reach out quite a few years back to me to say, hey, let us have a conversation about population health and what machine learning can do. And I've been tremendously fortunate to have collaborations with them ever since. So I'm very excited about this session. I hope to learn a lot from you as to what you find useful and interesting. And I want to send a big enthusiastic message. Find your own favorite research lab in machine learning and try to join forces with them. Thank you.
Thank you so much for that. Great intro. And I would like to hand over to Tom for a bit of an idea of what we think are some challenges that clinicians currently face in machine learning. And yeah, Tom, over to you.
Thanks. So I'm Tom Callender. I'm a consultant in public health and a clinical fellow at the University of Cambridge. And as Mihaela and Tim have said, I've been working in and around CCIM for quite a long time now. And Tim and I have been thinking quite a lot about what are some of the challenges that we feel that clinicians, either in training or later on, face when it comes to AI, and how do the two worlds really marry up? And I'm keen to get feedback on all of this. So please fire away with questions later on as you if I say anything that you massively disagree with. But because this is quite anecdotal, I suppose, in some respects. But if we think about the two worlds, I think as a clinician moving into artificial intelligence, the first thing to note is the sheer speed at which it operates. And that's both exhilarating, but quite difficult to stay in the wake of. Things change very fast. By the time that you've put in a grant or you decided you want to use one method, frankly, it's been superseded. We do work currently on using methods that didn't exist 6 months ago, let alone 3 years ago. So in the time frame of a normal clinical fellowship, for example, which are 5+ years worth of grant, these things change. It can be quite difficult to put them out there. But not only is the speed within the AI world of developments difficult from a clinical perspective, but the incentive structure and the training and metrics of the two worlds are very, very different. So if you have a lab filled with computer scientists and mathematicians and statisticians and engineers, fabulously intelligent people, but they've got to do their PhDs, they've got to get the papers into NeurIPS, ICML, iClear. It provides a kind of way of working that is very alien to medicine, where frankly we just don't operate on those kind of timeframes. And it's fascinating to watch, because one of the things I've really seen in CCIM, but I expect it happens in other places, is how the lab operates almost like Canada geese in formation. There's somebody who's leading a project, and then everyone else will form in behind to support and get it done as fast as possible. And then you move on to the next, and you're all supporting each other in a team structure that is very different from how I've seen in clinical medicine, where frankly, yeah, we might be a team, but in theory, everybody's working on something that's slightly different, and they can take yonks to go and do it. And that's just kind of it. And the time doesn't matter as much, if I'm honest. And so I think we have a lot to learn from that. But the difference in incentive structures in terms of got to get the papers into really big venues for machine learning mean that it can be very difficult to then do some of the work that's, say, longer from a clinical perspective. By the time that some of the papers have been written in Mihaela's lab, that would probably be the time it takes for us to get ethics applications done in the clinical school. So we're talking different eons. But the thing that I think we can learn and take from that is that actually we need more role for translators. And it's something that Tim and I have been thinking about in terms of there are lots and lots of efforts to train clinicians in the basics. Almost all clinicians of the future are going to use AI in one way, shape, or form. But there's a very big difference from using AI and understanding how it is used in practice and being the kind of expert researchers or even those who are in industry who are actively bringing the field forwards. And at the moment, if I'm honest, there is no training program for that. As far as I can see, there is one PhD in AI in medicine in the whole world, and that's in Harvard. And everyone else has to just make it up as they go. We all teach ourselves, essentially, if we're clinical people going into this world. But it's quite a lot you have to teach yourself. You've got loads of programming, there's all the statistics, there's AI itself. These are different. It takes a long time. And we have a lot to learn, but we need to develop programs for these future translators where you're a generalist role. Now, in public health, we're very comfortable with generalists. That is sort of what we do a lot. But you really have to be comfortable straddling two worlds where sometimes you won't understand your added value, but there is real added value to being in between the two worlds where you really know enough about the machine learning to be able to dream, as Mihaela said. Most of the things that are exciting in machine learning and in artificial intelligence are the transformative bits, where you're not just dropping in a new version of XGBoost to replace a logistic regression. I mean, that might be interesting, but it's pretty minor stuff. The things that are big are transformative, but you really need to understand how these methods work at quite a detailed level to be able to even think how you can transform using that, to be able to design the next generation. And so that's something we've been thinking a lot about, is how do you build and create the next generation of translators so that we can work hand in hand with these advanced machine learning labs and actually take the best of it, not always pretend that we're going to be the ones who are building it, but we are the ones who have the time potentially to translate bits of it. And that, I think, is an important role. It's an important step. It's something that we haven't really built very well. It works in some areas more than in others. For example, radiology is much more used to this than different fields of medicine. But we're going to be using this everywhere. And I think that this is something that we probably need to focus a little bit more on. Is not just training everyone in a bit of medicine, but everyone in a bit of AI, but really seeing how do you create a more expert role. And that's not just for clinicians. So as Mihaela said, that might be that clinicians spend a lot more time doing AI work. Some of that will be within AI labs. There's loads to learn from that crossover. But there's also loads to learn in the other direction. And there will be people from AI labs who fundamentally want to have a career in healthcare AI. And actually, we probably need to think about how do they spend much more time on the ground with clinicians. Clinicians are taught to think in a certain way. Once you understand how they're thinking, the types of information they have access to, what they are, how they're ingesting things, that can really help, I think, in how they structure problems and devise solutions. The only other bit, though, is that the translational aspect is not necessarily about pretending that medics are, or at least very many of them, are going to be programming and creating the new methods at the level that many of these AI teams are. It's probably not even necessary to worry about that. There will be some clearly who've done computer science and who really want to go and do that. It's very, very valuable to know how to program. Without that, you can't really understand a lot of these details. But there is also a role that we've been thinking a lot more about of how, within the machine learning world, you build the tools so that they are instantly accessible to many more people. A little bit like how you don't need to be an expert engineer in order to be able to use a lot of the tools that we have in medicine. We don't disembowel an MRI scanner to be able to use it. And similarly, the lab has been building things like co-pilots, using LLMs in clever ways to think about how do you actually make it really easy for people to have access to state-of-the-art material without necessarily having to go and do it all themselves. And I think that the two things will be a kind of having a more translatory role and having machine learning that really interfaces with the needs of clinicians will be an exciting future, frankly. I will leave it there. Tim, Mihaela, do you have anything else you want to add to that?
Fantastic. Thank you, Tom. No, I think that really captured what we mainly talked about. I'll give the floor to Tim O for a second to introduce how we're going to do the broader panel introductions.
So we're very fortunate to have a lot of panelists today. So to keep everybody involved and also to have some time for the discussion, we'll implement a timer, and that looks like this on screen. And that is your time to highlight your challenges, introduce yourselves, and then we go to the next person. And then after that, we'll go to the discussion. So that's it.
Okay, fantastic. How about we just go alphabetically? Dr. Anwar, would you like to kick us off? Thank you.
That would be easier to show graphically. So yeah, I'm Aizaan Anwar. I'm a UKRI AI for Health PhD candidate in AI and ML at Imperial. I'm also an internal medical doctor with special interest in neurology. Not a neurologist, but I've spent a lot of my training in different neurological departments. So my experiences in ML involve three projects, basically. The first is my PhD project, looking at speech as a digital biomarker in brain tumors. The second project was with NHS England's data science research analytics team, where I looked at evaluating clinical word embeddings for name entity recognition and linking in neurology. And the third is something that I've sort of been developing throughout my PhD, which is looking at criteria for determining machine consciousness. And I draw from my experiences in clinical neuroscience and ML experience. So challenges working in this sphere is like what Dr. Callender said. AI in healthcare is not a monolith. It is highly interdisciplinary. So I have to draw my experiences from not just clinical medicine, but also electrical engineering, natural language processing, acoustics, clinical design, etc. And so there's always that tension and challenge, balancing depth and breadth. And the other thing that I find is the greatest challenge in my work is actually trying to apply machine learning techniques that have been developed based on vast amounts of data in real world medicine, where we have such a limited amount of data. So for my work, I actually had to set up a clinical trial during the pandemic to collect speech data from brain tumor patients and healthy volunteers. So this is a population with high morbidity and low survivability. So it makes it a lot more difficult. That's where I find the mismatches, and something that I would really love to work with your team, because I understand you look at synthetic data as well. So I think it shouldn't be that clinical medicine tries to tailor to machine learning. It should be the other way around. And I think that's an exciting area of research.
Okay, thank you. And then we'll go to Dr. Montagna next.
Here I am. Thanks for having me. I'm so excited. I've been following you for quite a long time. Also took part in a CCAM summer school some years ago. So I am based in Milan. I am a physician by training, and my specialty is in internal medicine, which in Italy is a real specialty. And this specialty focuses on complex, fragile, multimorbid patients, elderly patients, where basically taking decisions is becoming really difficult because these patients are new patients that we have never seen before, and they are not in a randomized control trial usually. So we need new evidences, new clinical decision support systems, and these should be based on real world data. So my focus is mostly on real world data, how to leverage them with machine learning to extract information and answer some clinical needs. So I've been training a bit on machine learning, but my real question was really what is enough? So Tom was mentioning knowing enough of machine learning in order to interact with these tools, and really knowing what is enough is not easy. I think we need some kind of supervision, somebody telling us how far going, also depending on how keen we are on learning these tools. And then, of course, I completely agree that the other challenges about data quality. So accessing and using large quantity of good quality data set is something which is very difficult. It also depends a lot on where you work. For example, in Italy, we are quite behind in terms of data availability and digital health in general. And about this, I think there's a huge effort we need to put in place towards training physicians, all physicians, the physician community, on the value of data. And I think we are learning. So working with machine learners actually helped me to improve my work as a clinician, because now I can see my clinical activity as a source of data. I must be very scientific, very rigorous, very precise in giving labels, in taking decisions, in describing what I'm doing, in collecting data, in really being thorough as a physician. Whereas most of us, as we are in hurry, we most of the times are very superficial in the way we do our clinical activity. So I think it's a bidirectional learning, and it's very interesting. So thank you, really.
Very interesting. Thank you. Let's hand over to Dr. Vandeweerd next.
Yeah, hi everyone. So hi, I'm Valerie. I'm actually speaking from the industry perspective maybe now. I'm co-founder and CEO of a healthcare startup called Montagna. I'm actually a doctor by training, and I worked as a gynecologist for a couple of years, but always had a very strong interest in data science and healthcare. And that's why eventually I decided to switch to the pharmaceutical industry, coming from the clinic, where I really worked in Johnson & Johnson, specifically as a role as a translator. I think the word was used earlier, where I bridged the gap between data scientists and medical experts. But actually what really changed my career was a personal experience where a few years ago, someone close to me was diagnosed with an aggressive type of cancer for which there was no standard of care left. And I actually turned to clinical trials, and I was searching for one, hoping to find another treatment option. But even with my background, it was incredibly hard to find a suitable option. The information was fragmented, outdated, and nearly impossible to navigate. And at the same time, I was in the pharmaceutical industry, and I saw on the pharma side how difficult it was also for them to find and recruit eligible patients, not because patients aren't out there, but the current systems in place rely heavily on doctors manually identifying trial candidates, which is inefficient, slow, and very costly. There were some tools designed to tackle this problem, but almost all relied on structured data queries. And I think we all know doctors don't write in structured checkboxes. They write in rich, detailed language filled with subtleties. And that disconnect really leads to missed opportunities. This actually happened in the midst of the Gen AI boom. And suddenly we have these tools that can really understand clinical data in the way that doctors think and write. And that's when I actually founded Montagna, where we are building Gen AI tools that work alongside the doctor, reading consultation notes to match patients with relevant clinical trials. When there is a fit, the doctor is notified instantly. But I was asked here to tell you about the challenges that we face, and maybe different than most colleagues here today, I really bring the challenges from an industry perspective as an AI startup. And for me, the challenge really isn't building smarter, more complex, more accurate models. It's about making sure that the extremely good models that we have today can actually be implemented and make an impact in clinical practice. I think the first important part is to build with your clinicians. Make sure you build tools that they will use, that are user or clinician friendly as we use it, that can actually be implemented in their existing clinical workflow. But even if you have that, I think there are 3 other challenges to actually make sure you have a workable system. I think the first is GDPR and data privacy. We're dealing with very sensitive data here. And when you want to use complex AI models such as LLMs, you have quite high computational resources needed, which often requires cloud capabilities. Our challenge is to convince hospitals that we have the right mitigating measures to actually do our data processing in the cloud securely while remaining.
Maybe
Okay,
highlight
time's up.
the other 2 challenges shortly. I did
Okay.
not know that
Okay,
sound effect would play.
It's okay. So it's very quickly, the other 2 challenges are for us IT integration across hospitals. Each hospital has different IT infrastructure and different terms of digital maturity. To align these processes is very difficult. And last, I think if you want to have sustainable and impactful AI tools, there needs to be a sustainable business model as well. The financial structure of hospital systems is very complex, but I think this is one piece of the puzzle that we also need to solve to make sure that we have an impactful system. But I really believe that we can tackle all of these challenges, and when we do, we can have a really great impact with these new AI tools. I'm sorry for going over time.
No, you're going great. Just the timer going. Okay, thank you. I think we'll go to Dr. Khare next, Dr. Avneesh Khare.
Everyone, it's a pleasure to be here on this esteemed panel, and I'd like to thank the organizers for the invitation, especially Professor Mihaela and Dr. Tom and both teams. I have been attending RS sessions before, and I was also part of the last summer school cohort. So I'm Dr. Avneesh Khare from India. I am an anesthesiologist and critical care pain management specialist by training. And now I'm a full-time educator, advisor, and thought leader. If you can say, I'm a LinkedIn top voice in the field of AI in medicine. I basically work for a not-for-profit organization, which is called Doctors AI Education and Research Foundation, or Doctors AI for short, along with its academic wing, which is the Indian College of AI in Medicine. So this is a new organization, and our mission is to empower medical professionals, and as all the speakers said, to help them engage meaningfully with AI, and particularly those people who don't have any prior exposure to this AI in their clinical training. So they are completely clueless when they come and they talk about AI. So we do this, and then also as a part of BrainX AI Lab in the USA, I have contributed to annual reviews of annual AI publications across PubMed, and also I have supported organization of a few datathon initiatives. So that is my participation in an AI lab. My journey into machine learning has not been through the traditional research or coding side. In fact, it has been through education. So while working on the front lines in COVID, I witnessed a growing disconnect between AI's potential and what clinicians actually understood or trusted. And that gap, although not technical, it was cognitive and more cultural, and that is what drew me into this AI in medicine. Today, I'm focusing on shaping an ecosystem that makes AI relatable, usable, and context aware for medical professionals. So we very much align on the same lines as your lab is working. And I help design structured learning programs, conduct workshops, and mentor clinicians. And also I support AI startups. So to the challenges, one key challenge I see repeatedly is the assumption model mismatch. Algorithms don't account for the messiness of real world healthcare. And when clinicians don't understand how these work, they don't adopt it. So that is one challenge. Another issue is the expectation gap. The AI is already overhyped or prematurely dismissed. There's a lot of fear also around AI. And I think this much of this stems from lack of grounded, informed, clinician-led dialogue. So that's the work I care most about, bridging these gaps through education and collaboration. And I look forward to sharing more during our discussion and learning from the diverse experiences on this panel. Thank you so much.
Thank you for that. And then lastly, we are really glad to be joined by Dr. Samarghitean, and I'm going to share your slide in just a second as well.
Thank you, and first for the invitation to this distinguished panel. I also thank you for all the sessions before. I've been also part of the summer school and all the revolutionary talks, and I'm really excited about all the sessions before and about this session. And I'm a medical doctor by training, a general practitioner, but also specializing in pediatrics. Finished my medical school in Romania, but then I moved in Finland, where I started my PhD. And during my PhD, I worked in an AI lab. Actually, it was bioinformatics lab at that time, and focusing developing expert system, decision support system to help doctors diagnoses of primary immunodeficiencies, which are rare diseases of the immune system. And during my PhD time was a lot of challenging working as a clinician at the interface between clinicians, like those who are working in practice, collecting data or seeing patients, and bioinformatician or software computers guys. And the challenges not only came from the lack of data, because these patients with rare diseases, sometimes there were one patient in the world, so we have to collaborate with many labs in the world to collect the data and develop the knowledge base, but also have to curate the data and also provide the HPO coding. And also because the challenge is the disease itself, they have overlapping symptoms, so very difficult to diagnose by the clinicians. And also we have challenges when we develop the AI model in trying to get adopting or collaboration with doctors, because the first time they were reluctant to see They were afraid. And the first time when I presented the prototype, the doctor from different hospital told me, "What do you want? Do you want to replace us?" So this was at the beginning when we started to develop this kind of models, but it was a challenge. I think was more psychological, a fear of replacement. Of course, this is a more difficult area of medicine. But I think it's needed a lot to have this AI, machine learning, and more education for clinicians. That's why I try to join these sessions and also try to increase awareness, especially for doctors, about this kind of tools and collaboration between data scientists, AI machine learners, and doctors. So I really appreciate this kind of sessions and panel discussions, and I hope this kind of challenges I have during my PhD and after will not be in the future. Thank you.
Fantastic. Thank you so much, everyone, for sharing your experiences already, and really looking forward to the rest of the discussion, which we're now entering. I think sort of the elephant in the room, and lots of you have touched upon this, is how much or which knowledge is actually needed for clinicians to either function in collaboration with machine learners or to even build machine learning models themselves. And I'd be really interested in the experience you've had there. And is there anyone who would like to start? Otherwise, okay. Otherwise, maybe this is a good question for Tom at first, because you've basically done your own AI in healthcare PhD and built your own system. So what do you think is really important for people to know?
Important to know about how to create your own program. I mean, with any of these things, I think the most important piece of advice is that I could ever give to somebody who's more junior than me trying out on this route is persevere. Almost everything that you need to do is through doing it. You need to be able to show to people that you are worth them taking on. So when you're junior in these kind of fields, you do need to go and try things out. You need to go and say, okay, well, I'm going to build X model and I'm going to prove that I can use Y tool. And then when you can do that, then people are much more interested because you've kind of shown that you have the gumption almost to get on and just do it. No one is going to do it for you. There's loads of people around, and you just need to persevere. It takes an awful lot of time. And then once let's say you built something, it doesn't end there. So we built various bits and pieces for my PhD, which feels like it was in the age of the dinosaurs, but it wasn't that long ago now. It's only a few years. But in the AI world, it is the age of the dinosaurs. We're now in the process of thinking, how do you actually implement it? And as everybody said, that gap between, okay, well, we built it, we made some fun things, but then how do we actually get it to work in practice? And that's a question that is complex for several reasons. One, because as people have mentioned, there's regulatory reasons and challenges there. Two, because, and that's something for which most of us have absolutely no experience. And two is then clearly you need to find partners to implement it and things like that. Now, I actually find that bit's not that difficult, if I'm honest. If you have a good enough idea that really will save somebody money, in general, they're pretty keen to use it. Now, if the challenge is being able to prove that it's safe and other issues. Now, that's where the regulation bit, that is far from simple. But it means that you then have to develop a secondary skill set, which is how do you get something out? How do you, for example, you might have to build a company because something might have to hold the IP because it needs to be regulated. And then for example, if you want a CE marking for your model because it can change clinical practice, it has to have somebody take responsibility. Now, no university will take responsibility for it. So you're going to have to create a company that will hold the IP. These involves a whole different set of skills. So I suppose I'd say that you've got to persevere. It's good fun. It's a long journey. You're going to learn the whole time. Valerie will no doubt have lots of experience from the other side. But yeah.
Thank you. Yeah, I think it's brilliant if you use the raise hand feature such that we can get through everyone. So I think next on the list was Dr. Vandeweerd.
Yeah, hi. Thanks, Tom. I'd love to chip in here because I think what you stated was spot on, but maybe what we also don't need to expect is one person to be able to tackle all parts, building the models, then getting it to market and using it. I think it doesn't need to be in one person. I think that's very difficult to do. I'm not decoding. I'm not coding any AI models. So making sure that you can collaborate with each one of the team members that brings the necessary expertise, I think that's very important, and maybe not trying to find one person that can do it all, but really have that team that can really work together to bring that to market. But what I think is actually getting what is important as for all clinicians, my goal is to build a tool that is so easy to use that you don't realize that it has a highly complex algorithm behind it. So what you actually want to do is make it so easy that everyone can use it. But what is important for each doctor then is be open to new types of tools. I think that's the one case. Be open to trying it, because if you don't try it, even if it's that simple, you will never be able to use it or make an impact. So my goal would be also is to raise awareness about the potential of these tools and just be open to it. Be open to using new things. This is how these things can actually make an impact and can grow as well. If we collaborate with a partner, with a champion that is excited, and we still need to learn as well, this really helps the tool get mature and can reach the whole market. So if you're not willing as a clinician to help build the models or making them into tools, at least be open to them and try them and explore them. I think that will help a lot as well.
Thank you. And Dr. Montagna would be next on the list.
Yeah. So I was thinking that when people ask me this, so younger residents or students, they ask me, I want to learn a bit of machine learning for medicine. What do I do? Where do I start? So I send them a series of links of resources. Like, there's this Harvard data science track. There's Microsoft Learn Pass. There's introduction to AI from a Finnish university, etc. But what's the benchmark? So where do you stop? I think it's interesting. What happened to me is that I visited the Van der Schaar webpage, where you post your models, your GitHub, and there are tutorials to follow, and I couldn't understand anything. Then I went and had those courses, the Microsoft Learn Pass, etc. And then I went back and I could start managing those libraries, download them and install them in an environment and start to interact with them. So I think that was a good benchmark. And maybe what you can do as a Van der Schaar lab is try to really create a web page where you link some resources. So if you're a physician, you want to learn the basics of Python, the basics of machine learning, just complete these tracks, go through them, and then when you're able to interact with our GitHub, you're good to go. I think this could be something that it would help us a lot, because if you just Google if you just Google machine learning courses for doctors, you get a lot of stuff that most of them maybe are not really useful. So I don't know.
Yeah, brilliant idea. Thank you. Really good idea. Then Dr. Samarghitean, you would be next.
Yeah, so I agree with Marco. I think it's very useful for doctors to have this kind of introduction to Python or R, at least the basic skill, or GitHub to how to, because this helps them to navigate better also to this more advanced, like summer schools, AI machine learning, if they have the basic AI machine learning. I took a lot of course. I've been to lots of Python courses, R, and GitHub during my PhD, and after that a postdoc at Cambridge University. And also I feel sometimes was difficult for me, but because I took so many courses, not only 2 courses, but also program, then I start to understand and collaborate better with the computer scientists, and also understand the AI models, and I could help them, not only on curating the data or translating or providing HPO code, but really like doing a checkup or some R scripts or Python. But for this, I need to have a lot of AI and machine learning in Python, data science course by informatics before to understand. So what more you understand from the other side, it's better than to be a translator between medical doctors and computer scientists. This was my experience. So yeah, it helps to have also this kind of introduction, like more basic levels. And after that, you show them the models and how to use them, because otherwise it's quite difficult for somebody who has never programmed or never been experienced with AI machine learning. Yeah.
Thank you. And before we move on to the audience questions, Dr. Khare, your thoughts on what medics should know about machine learning?
Yeah, so just thoughts, because I'm working in the field of AI education for medical professionals, and I get to talk to a lot of them on a daily basis, and I get to know their problems. So I think one thing I agree with Valerie, that which I tell them firsthand, that AI is a team sport. Someone told this to me a long time back, and you cannot do everything yourself. So you need to be very much goal oriented. You should understand, first of all, what is your goal of learning AI. Whether you want to build an AI tool, you want to be a developer, or you want to be just an informed end user, or you want to be somewhere in between, like the translator, as Tom said. So that is the first thing that you should decide, and then that can even change in midway. Like you might start thinking that you just want to be an informed end user, but then down the line you realize you like coding so much, and then you start developing that skill and becoming on the developer side. So this is something which I always advise to them. And we have also written a very nice paper called Navigating AI from BrainX AI Lab, which talks about how to navigate this and how to find your goals and how to develop a customized learning plan. So one size fits all is not going to work. It's always going to be customized, and that checklist, it gives a checklist also. So you can just go through that checklist, and then you can, in the end, you come to realize that, okay, this is my goal and this is the resources and this is how I should go about it. So that is also kind of resources which we should build as AI labs, like what should be the checklists for deciding your role in AI labs and AI in healthcare. So those are my thoughts.
Okay, great, thank you. We also have some audience questions, with the first one being from Ashmi Rahiman. And maybe you can unmute yourself and ask the question yourself. I think we've touched on it a bit, but it would be maybe nice for the panel to elaborate it further. She said, Drew, if clinicians wish to co-create and explore the possibilities of AI in medicine, what are the essential certifications or skills he or she should attain after medical school? So feel free.
Basically, is there any structure to it, any milestones, any particular degrees?
I think it's good to follow after your medical degree, a master, starting from 1 year. So I personally finished a master in medical informatics and biostatistics first. That helps me. And then after that, if you realize that you are so in love with this and want to develop more, to go into a PhD, which has AI machine learning focus in healthcare. And then, of course, there are these certificates, postgraduate certificates you can follow who have data science, AI, machine learning. This will help a lot to navigate more from the medical clinical background to this AI machine learning and healthcare field. Without that, because this kind of programs give a structure and the basics, an introduction to all these Python, R, GitHub, or other programming courses, and then the basic of AI machine learning in healthcare. I think that's and give a structure, and also it helps you. It gives you the communities, give you the collaborators, and then after that you can build on that. And then also it gives you opportunity to consider if you really want to go further on this, or you want to focus more on clinical practice.
Thank you, Dr. Khare, if you would like to go next.
Yeah. So again, as I said, the first thing that you should understand is what is your goal of seeking that degree or certification, because if you are going for a degree or certification of 2 years, 3 years duration, or like a PhD, you have to be much invested and interested in the space. So go that distance. As Tom said, you have to persevere. So I think initially what you should do is you should try some low investment and low stake kind of an environment, like summer schools. Like we had a summer school last year, or a few days workshop, or there are even communities out there online, and this is also a wonderful community. So try to attend more and more programs from this community once you are in your medical school, so that you get an idea of what you want to do later on once you complete that degree. And I would say, don't go after degrees. The industry looks for skills. Outside there, you should be data literate. So go for some skills like data literacy, understand how data functions, how medical informatics works. You need not be a MS medical informatics to know that, right? Nowadays, there are so many resources out there. So I completely agree with the previous panelist. And just to add to that, be very goal specific and always be understanding that degrees won't get you opportunities always. It's going to be skills and solving real world problems.
Thank you. Then we had more questions from the audience in the chat. Sangeev had a question. He's a clinician who has become deeply involved in AI innovation. Would you like to unmute yourself and ask your question live?
Hi, guys. Thank you so much for this opportunity. So my question is, I'm in the crossroads of either learning AI or building AI to solve real-world problems. So I have been in the struggle of identifying new AI concept that is evolving every day. I couldn't keep up with any of them. But if I could take one from few months back, it even that implementing into real world problems takes such a long time. So how do I keep up with the advancing landscape and try to solve my problems? So where should I find the balance there?
Say the most valuable part. I saw that your question actually was a little bit more complex when you put it into the chat of the Zoom. And I would say one of the most amazing skills it seems that you have is to understand enough about AI and understand enough about the clinical world to see the opportunity, to see what tools could be useful to solve a particular clinical problem. And I think we do not have enough people like both Tom and Tim have mentioned that are bilingual. I think that often we have a lot of machine learners like me and my lab, and there are many other labs like this in the world that are trying to solve real world medical problems, healthcare problems, but we don't know what problems to solve. Conversely, we have often clinicians that may be interested in solving a problem, but they may not even think about AI as being capable to do that. So I would say maybe the most important part is for you to play this dual role. I think that there are very few people who are bilingual. If you are, I would say that's your most amazing asset. The fact that you speak these two languages. I think that's more incredible than just speaking very well one or very well another. There are very, very few people who understand and speak both, and you are unique, and you should cherish that. And I think that holds true for all the panelists. So I'm tremendously excited to hear about you and your journeys, because there are so few people who can do both. I definitely can't. So with respect to how to find your machine learning collaborators, your AI collaborators, there are many solutions to that. One of them is to find education resources online. Another one is to come to summer schools, like for instance, the one we organize every year that is dedicated to clinicians. You can meet there other clinical collaborators, but also machine learners. Another solution is to go to some of the key machine learning for healthcare conferences and workshops that exist and try to find people there that are interested, or try to excite a particular machine learning lab about your particular problem in the local area where you live or where you interact with other researchers. At least this is my thought about it.
Thank you so much for the kind words. It just feels empowering hearing my ideas to be validated. Thank you so much for that. And I am actively pursuing all the things that you are trying to say. If I have one more minute, I can add up on one more question. Is a degree is actually worth it to pursue AI in healthcare, or can I just learn on my own, do my groundwork by solving real world problems with the people rather than pursuing a degree?
If you ask me, I would say a degree is only necessary if you really cannot do it yourself. But if you can do it yourself, if you find the resources, if you have the time, if you find that it may be as good. I don't think just having a degree to have a degree will help you. If you find the right degree that can accelerate what you need, then yes, it is useful. So if indeed you find a degree aligned with your goals, with your purposes, then I think it's fantastic because it accelerates and it may eliminate some blind spots. But at the same time, I feel even though I pursued many degrees, I'm not sure all of them were necessary. Let's put it this way.
Thank you so much. Thank you so much.
Thank you. Dr. Montagna, would you also like to add something to that?
Yeah, about the way of how to find people working on AI in healthcare. What as physicians we can do is go and look in our scientific societies. Most of, at least European scientific societies, are building working groups inside them on AI in their fields. So whenever you go to a conference of your medical society, just ask, is there a working group on AI in our field? Because most of the societies do have them. And inside those groups, you will find people like us and also people coming from the pure data scientists. It depends on how the working group is organized. And those working groups are usually trying to do education activities, networking, research groups, grant applications all together. And they're very interesting chances, I think. So look for working groups in your scientific societies.
Thank you, Dr. Marco. I will. Thank you.
Thank you. And since we already touched on degrees, for those of you who have done a master's or even PhD in the machine learning field, what would you say were the most important learnings, the most important topics that were covered? Or would you say in hindsight, you would rather just have done it by yourself and just started programming?
I think if I may, I'll probably, so I saw question about how much clinical work do you need to be a translator, how much ML experience you need to have. So I probably will have to go a bit personal in my journey because for me, for the longest time, I wanted to be a neurologist. I wanted to be a hardcore hospital physician. So I did all my postgrad exams, spent time at the National Hospital for Neurology. And the reason why I went down on this path was then I discovered what I love. And I think this speaks to what Dr. Avneesh was saying earlier, is to really find your niche because the space is so huge. So if you want to be, I think if your degree was worth it or not, I think I say like for our program, we had to do a lot of modules in AI. But what I found was that a lot of them were very general, and so it harks back to what I was saying earlier, that AI is not a monolith. Truly find the specific problem that you really enjoy working on, and speak to people who are doing a bit of both in ML and healthcare. So I don't, I mean, I had to do those taught courses in my program, but if I could do them again, the way I would do it is actually just go very specific to the person who's doing exactly what I need to do. Digital biomarkers, speech, AI, healthcare, neuro. So yeah, so whether degrees are worth it or not, if they really meet your goals and your interests, perfect. But if not, then it's just too much to catch on. Yeah, that would be my 2 cents.
Very insightful. Thank you. Guess Dr. Samarghitean.
I can summarize, and what really helped me when I work in these multidisciplinary teams, it helps me a lot to do coding in R and Python. So learn this and be proficient. Even maybe you will not be an expert, but once you start to code and understand them, that was much better in terms of communication, understanding the data scientists, so collaboration between me and other more computer scientists or AI machine learning. I think those courses were important for me. Of course, communication and then data visualization and all more theoretical courses, but practical really do the coding. And it took some time, but you can do it just by practicing. More you practice, more better coder or you are programmer, and then also collaborate with your colleagues. in an AI lab. For me, it was essential to really do the hands-on work and because I have to maintain sometimes the websites and also do the scripts, R scripts. And at the beginning, I didn't know, so I have to do the course and do the programming. So that helps.
Thank you. Also, an encouragement there for a practical experience. Thank you all so much for everything you shared. I think we could have talked for much longer. Before you all leave, I would like to share some final notes for today. Coming up next is our summer break, but as we've already mentioned, there's one perfect opportunity to get started in your AI journey, and especially if you're someone who's very interested but just starting out with clinical expertise but not really machine learning expertise, this is the perfect opportunity to build this foundational machine learning knowledge and sort of understand what's going on in the field. So we really hope that you will join us in September for the AI and Machine Learning in Medicine Summer School. And apart from that, we are really excited that you were part of this journey of revolutionizing healthcare thus far. The 45th session, really exciting that we've already made it this far, and we're really happy that you were all here today sharing your experience. We're also excited, of course, to see you back after the summer break for more revolutionizing healthcare. So thank you again, and thank you to all the great panelists for sharing their experience.